talk about hand washing, because that's something you've been really talking about is one of the biggest ways to prevent getting sick. What's the proper way to wash your hand?
20 seconds. So we've discussed this previously. Singing happy birthday to yourself twice in your head is 20 seconds. It sounds, when you're doing it, it almost feels unnatural because you're not used to washing your hands that long, but that is how long it takes to properly wash off the germs, the bacteria, the viruses, to prevent transmission. It's really important anytime you're touching any public surfaces. I always mention door handles, elevator buttons. Think about the things that people are touching commonly. They may have sneezed, they may have touched, and then you touch it, touch your face, and then there's potential spread. So washing the hands is very important, making sure to get all surfaces, your thumbs, your wrists included, and using hand sanitizer when you don't have soap and water, but if you have soap and water, that is the best.
And that would be the best way to prevent from getting sick.
Exactly. Not touching your eyes, nose, and mouth as well. We tend to touch our faces quite a bit. As I demonstrate right now, I tend to touch my own face quite a bit, but being cognizant of that and trying to avoid touching your face, washing your hands, and if you are sick, staying at home, or if you have to be in public, wearing a mask, and if you don't have something that you can cough into the crook of your elbow.
Okay, so we have a lot of questions, and I know a lot of viewers do. So Dr. Ruby, let's answer some viewer questions that were posted on the KHON2 Facebook page. So Jenny asks, how long does the virus last on surfaces? How long can an N95 mask be worn and can be reused?
So the virus, we don't know at this point exactly how long it lasts on surfaces. What we have to look at is other viruses and make some assumptions and educated guesses. Now, in general, viruses can last from a couple of hours to a longer period of time, but in general, viruses don't survive for very long. The influenza virus, as an example, wouldn't be able to survive travel. Folks are concerned that travel from China to here, if they're getting a shipment or whatnot, it's unlikely that a virus would be able to survive for that duration of time. Now, the N95 mask at this point is only recommended for healthcare professionals who are in contact with an active case or a suspected case. Those are the only folks that should be wearing N95 masks at this point, and any mask should not be reused. We've talked in the past about there's different layers of the mask. There's an outside layer that repels fluids, there's an inside layer that filters, and there's an inner layer that actually absorbs moisture. So as you're talking and whatnot, you're actually moisturizing that area, and what happens is if you ever reuse it, that moisture can breed bacteria, so it's pretty disgusting.
Germs.
Yeah, it can cause an infection, so you never reuse a face mask.
All right, good to know. All right, let's get to another question. Ches wants to know, can cold or cooler temperatures help fight off the virus?
So that's unknown at this point. It does not appear to be the case. In fact, if we extrapolate from other viruses and other infectious diseases, us living in Hawaii in a tropical climate is actually pretty beneficial because we're not in closed, confined spaces because it's cold outside. So we're actually lucky to be in a tropical climate where we're less likely to be coming in close contact with folks who are sick. So even for influenza and whatnot, we're outdoors. We have a lot more space and folks are actually willing to be outdoors in the winter, whereas in other places, they're in closed, confined spaces, there's a lot of people that are around, and you're much more likely to come in direct contact.
I would never have thought that's how temperature affects it.
Yet another reason why we're lucky to be living in Hawaii, right?
Yes.
All right, Thomas attached his image that's circling online. So Dr. Rupi, he wants to know if this is accurate.
Okay, so there is a lot of misinformation being spread on social media, Facebook, Instagram. You have to be very careful about who you're looking at, where you're getting your information from, especially at a time like this. This is an alarming situation. It is rapidly evolving, and unfortunately, people take advantage of that, and they have their own agendas and whatnot for spreading misinformation. So your main sources of reliable information are the CDC and the WHO. They're going to be the most up-to-date, they're going to be reliable, and that would be where I would turn to for information, especially if you have any questions about what's happening.
Lastly, Dr. Rupi, as you mentioned, it's important not to panic.
Absolutely. So when something like this is occurring and there is concern and panic, it's most important to stick to the facts. What exactly is the situation? What is happening? At this point in the United States, we're at a much higher risk for catching or being affected by influenza. We've talked about 15 million cases, over 8,000 deaths. When you put that into perspective, right now we have 7 known cases in the United States. There has been human-to-human transmission. However, it has been within close contact. We have had no casual transmission to the general public. And overall, even though the numbers are ballooning outside of the United States, there are so many efforts in place right now, including that public health emergency announcement, to help contain the virus and help to try to contain this situation.
Good way to put it into perspective. So getting the flu is more likely than getting the coronavirus
At this point,
here.
yes.
Okay. Thank you so much, Dr.
very
Ruby, for
welcome.
being with us in studio. And make sure to go to our Facebook page, KHON2, right after this newscast. Dr. Ruby and I will be doing another Facebook Live to answer any more of your questions.
Dr. Ruby, thank you again.
My pleasure.
If you also have questions, so you can find her on Facebook and Instagram.